Hello, my name is Dr. Sam Martin. I'm the founder and medical director of Vascular Vein Centers. This video has been developed to help you gain an understanding of your circulation, the anatomy of your veins and arteries, and how they work. The heart is the pump responsible for delivering oxygenated blood to the body. The calf muscle is the pump responsible for returning blood from the legs. Arteries have muscle in their wall to assist the heart in pushing blood to the extremities. Veins have thin walls and almost no muscularity. They depend on one-way valves and the muscles that surround them. If the valves malfunction, blood is allowed to flow backwards, causing veins to dilate and develop increased pressure. This is referred to as venous reflux and occurs almost exclusively in the legs and can cause damage to the tissue and skin of the lower leg. It is important to realize that there are three systems of veins. There is the deep system, which lies between the muscles of the leg and cannot be seen or felt. These veins are responsible for returning 90% of the blood from the legs. There is a superficial system. This is composed of the great saphenous and the small saphenous veins and their branches. These lie in the fatty tissue of the leg with no muscle around them and return most of their blood to the deep system. The perforator system consists of short veins with one-way valves which connect the superficial veins with the deep veins and, when normal, allow flow only toward the deep system. A normal valve allows blood to flow only toward the heart. For a variety of reasons, valves can become incompetent, allowing flow to go backwards. These include heredity, with a weakness in the vein wall, pregnancy, with a 50% increase in the volume of the venous system, hormonal, with progesterone causing a weakness of the vein wall, and occupations that require prolonged standing, which causes increased pressure and vein dilatation. Clots within veins can also destroy the valves, making them incompetent. Gravity, over time, causes progressive pressure and enlargement of veins. When you are lying, the pressure in your legs is very low. When you stand, the pressure in the veins of your lower leg can increase up to 90 millimeters of mercury pressure. Walking activates the muscles of the calf, often referred to as the venomotor pump. This compresses the deep veins and pushes blood to the heart, lowering the pressure in the leg. As a person walks, the pressure is further lowered if the valves are normal. If valves are abnormal, walking is not as effective in lowering the pressure, and when one stops, the pressure quickly increases as a result of gravity. There is a significant difference in a person with normal valves versus a person with abnormal valves in the degree of pressure reduction with walking. Jobs that entail prolonged standing, with little or no walking, cause prolonged high pressure in the veins of the lower leg. In a defective venous system, there is prolonged high pressure in the lower legs. This causes fluid to pass from the vein into the surrounding tissue. This fluid has a caustic effect on the surrounding tissue with progressive destruction. Skin and underlying tissue changes occur in the lower calf and ankle area. These are due to inflammatory changes in the tissues. The skin becomes dry and thickened over time. Initially, there can be pinkish discoloration, which is sometimes misinterpreted as infection. Later, the skin can develop a brownish discoloration, which is associated with increased stiffness and firmness of the underlying tissue. Eventually, ulceration can occur. Your initial consult consists of a thorough assessment of your symptoms and physical findings. a Doppler ultrasound may be recommended for a complete picture of your venous system. This non-invasive procedure looks at your veins and tells us how the one-way valves are working. We find which veins are not functioning and carefully document their location. Your treatment plan will be tailored to treat your symptoms and physical findings. This requires several treatment sessions per leg and usually consists of laser ablation of the great and/or small saphenous veins. If perforator veins are incompetent, they are treated. The varicose veins that are seen and felt are then treated using a chemical injected as a foam solution. It is important to treat the underlying causes of pressure before treating the visible veins. Treatment of leg veins is like cutting down a tree. The visible veins are not optimally treated unless one eliminates the root source, which is the great or small saphenous vein, which cannot be seen or felt. If the visible veins are treated without addressing these underlying sources, more veins will quickly appear. Veins are controlled, not cured. Over time, because of the constant challenge of gravity, veins will enlarge and need to be treated. This requires a trusting relationship between the patient and vein specialist. At Vascular Vein Centers, we have years of experience and use the latest proven technology to help you achieve leg health.